Hello, my name is Dr. Suvarchala. I am the Scientific Director with ZIVA Fertility Centers. What are the most important factors that we need to keep in mind when we are looking at what is causing infertility? So, if we know the important factors necessary to get pregnant, won't it be easy for us to then plan pregnancy? Remember, there are four important factors, four important parts of the whole machinery of reproductive system that needs to work very well. First is that you need to be ovulating properly. So the egg from the ovary needs to ovulate properly, that is to be released properly, because it has to come into the tubes, and that's where the fertilization happens. If the egg does not ovulate and you're having constant unprotected sex, then you will not fall pregnant, isn't it? So the first important thing is for proper ovulation. Second important thing, let's move up, the tube. The tube has to be patent. Remember, you have two tubes connected to two ovaries. As you can see, this ovary, if the egg ovulates here, the egg is picked up by this tube. If the egg ovulates on this side, the egg is picked up by this tube. So it's very critical that the tubes be open, tubes be patent. Suppose you've had previous surgeries or previous ectopics because of which the tube was removed, or you were born without tubes, then the chance of success becomes very low, isn't it? So the tubes are very important. The third thing is that the uterus should be good. Your periods, if they are regular, the uterus also will be normal. So the shedding of the endometrial layer is normal, your period is regular, there are no fibroids inside. There is no deformity which is present, like there is no wall inside it which is called the septa. The uterus is not divided into two parts, or the cervix is not blocked. Cervix is the opening of the uterus. If this is absolutely fine, it is not affected by endometriosis. If that machinery, that part of the machinery which is the uterus is fine, the third most important factor is ticked. The fourth most important factor, let's not hang on to the women only. The fourth most important factor are that the sperms should be normal. So the count should be good. The motility should be good, and the morphology of the sperm should also be good. So the fourth and the most important factor, if you would ask me, are that the sperm should also be good. If you are okay with these four things, that is, you're ovulating properly, your tubes are open, your uterus is shedding properly, you have no problems inside the uterus lining, or problems associated with the endometriosis and so on and so forth, and your husband's sperms are according to WHO parameters, then your chance of success is good with unprotected intercourse. If you want to understand more, if all these factors are perfect and you're still not getting pregnant, you want to understand what are the causes can cause infertility, please call us on the numbers that you see on the screen. Thank you.